Hi, this is Kyle Bellikapitsky, New York State PTA Executive Director, and I am so thrilled to join you this afternoon for a fantastic conversation really about supporting the whole child and supporting mental health. Thanks for having us. This is one of our spotlight presentations, which means all of our delegates and attendees are watching this from the comfort of your home, and we're really happy that you're joining us for the first ever virtual PTA conference. Let's hope it's the last ever virtual because we miss seeing people in person. This morning or this afternoon, I'm excited to bring to you two of our special guests. Both are known to you and have been longstanding PTA partners. Dr. Robert Rotunda is the Executive Director of the New York State School Counselors Association, who has many, many years in school buildings and practice. And Bob, thanks so much for joining us. And we're so thankful of this, the relationship we have with the School Counselors Association to support our children. Then we have Michelle Ramos, again, no stranger to New York State PTA. She is the manager of partnerships for GoGuardian, which is a monitoring and filtering company actually out of California that we work with that really provides safe spaces online for students when they're using especially school-based devices. So Michelle, thanks so much for joining us. Bob and Michelle, thank you so much.
Thank you, Kyle.
We're going to jump right into questions. This has been an interesting few months, I guess, to say the least, certainly for student and family mental health. We've had a number of mental health web chats and webinars over the past few months, really talking about these issues and figuring out how we can best support children and families. We wanted to bring this conversation to convention. If you do check out our webpage or check out the microsite webpage on-demand workshops, you'll see some of those previous mental health conversations. Bob, I want to start with you. What's been happening? Our students have been from March to September out of school buildings. Some of them are still out of school buildings. How is this? What is this looking like for students? What are school counselors seeing? What do we have to look forward to, I guess, over the winter? What's kind of the feel in our school buildings?
I think that the feeling, if you were to generically say it, is sort of insecurity. Sort of, we're not sure what's going to happen next. Just a week ago, Board of Regents said we're not doing the January regions. Everybody was concerned about the January regions. We had many questions about it, and so on. Now the question is down to what are we doing with the June regions? Because a lot of schools have changed how they deploy their classes in terms of quarters and thirds of years and so on. So an end of the year regents exam doesn't seem appropriate. The other thing that we've learned over time is that we have to be able to respond with social emotional learning programs, with mental health programs, with school counseling programs. We have to be able to respond quickly in a way that could be in person one day and the next day virtual, because schools close based on COVID cases. And so you see a lot of quick responses and sharing of resources from district to district to make things happen.
Bob, just a quick follow-up on that. So this is really the year where we should have had pretty much full implementation of our new mental health curriculum in school buildings. How have you seen that shifted? How have you seen school districts kind of shift that work?
I've seen it depends on the district a lot, obviously, but I've seen a lot of the plans that were put into place by a lot of districts. A lot of districts have plans and put into place in terms of group work, classroom work, and so on, who've been able to transfer that to virtual classrooms, virtual groups, and so on. So counselors are doing Google Classrooms just as if they were teachers. Counselors are doing groups. It's sometimes difficult because it's hard to do group work online like we're doing right here. And a lot of times there's parents in the background if they're elementary school students. So it gets a little complicated, but I've seen a lot of that stuff be able to be transferred over pretty seamlessly. One of the challenges, as I said, is that conditions change so quickly that you have to be real nimble to be able to to reply to the changes pretty quickly.
And I think that's really important. I know you as a school leader, and we work with many of our other associations, the Mental Health Association in New York State, our principals and superintendents and our teachers union and our school board members on this conversation. It's so critical. And one thing we always try to do is bring data to the conversation. So that's why I'm happy Michelle could join us this morning. Michelle, let's talk a little bit about data. So we've had this big shift in schools. You're in California. I know you serve the whole country. We're us here in New York. We've been, we closed in March. We came back partially in September. As I said, we still have some schools that are still not back in September. And we have this unique situation now. We are in person and we're remote for many students in many school buildings. So what does that look like for the data? What trends are we seeing for, the data, the back end of mental health, of kind of streaming and filtering? Are we seeing higher instances of reaches out for help or trigger words or things like that online?
Yeah, I think that this is all super relevant. And of course, we are monitoring our data in aggregate as closely as we can to better understand, what's going on. I think everyone has that big question, what's next? Something that we definitely saw during the shutdown was that students and teachers, we allowed our teacher chats functionality to be opened, more broadly. And so you see students reaching out to teachers more frequently. They're seeking connection. The other thing that we're seeing is actually during the initial shutdown, so that, March through May time period, we actually saw that kind of these, reaching out for support, specifically suicide related support, has actually decreased. And the theory there is actually that, there's varying levels of devices, some students don't have access to devices. So there's a lot of that, but there's also a whole lot more, kind of feelings that they are, and the research shows that folks are, teaming together to handle just like the crisis at hand, right? So there's that. The other thing that we are seeing is that though the suicide ideation and the alert traffic that comes in through our Beacon tool, which is our suicide prevention tool, is actually spreading out. Whereas, like during that initial crisis time, normally we see our traffic, 80% of our traffic comes in during the school day or, 8 to 8, but during that shutdown, we saw that alerting was coming in more on the weekends, and not more than during the week, but it was definitely increased and elevated on the weekends versus our normal. Now, right now, we're actually studying the back to school time period, which of course is difficult because it's so diverse. The one thing I will say is that something that we have been able to glean from our research is that the alerting behavior actually is different by domain. And what I mean by domain is the www.something.com, right? And so the actual most intervened, so the behavior that is intervened on the most is actually content related to suicide ideation and active planning, which is active planning is that category where students are actually making a plan. And for the most part, that actually happens within the Google search bar. And so the Google search bar has a whole lot more intentionality behind it. It has more narrative. And so even when students may or may not actually chat between each other and tell each other those kinds of deeper kind of feelings, they might actually type it into the search bar. And so that's something that we're seeing a lot of.
And I think that's news. We had not heard that previously about that Google search bar kind of reaction. So that's interesting to share. And I want to get back to talking about different technology that even parents and schools can use to try to help. Bob, were you seeing this, original shift in March to May, and then a difference in over the summer to now with school counseling and with kids coming to get help and seeking to get help? And how does that look? Did that shift as well?
Yeah, Michelle was talking about the timing of alerts being different from school day to all the time, and school counselors have found the same thing. They've found not only has their work day changed because everything's changed. Yeah. People are overwhelmed with what do I do next? How do I manage this experience? How do I manage this this reach out from a student. It's so different than that. We were talking in a meeting the other day about policies that districts have in regard to suicidal ideation, and everybody's got that in the book someplace. What's that? Now what does that look like in a virtual world? What does that look like it was pretty easy in a face-to-face world, but it's not as easy now. What do you respond to? What time of day do you respond to it? Who's responsible for it if you're not online at 9 o'clock at night? All those kinds of things that probably occurred some prior to COVID, but occur even now. The other thing that's really jumped out is the equity of opportunity, the equity of access. Who's got which devices and who can be online when.
Such a big issue, this tech equity issue, and we'll talk about that. But continue, Bob. I agree.
Yeah, no, just in terms of school counselors were really involved in the spring in delivering devices. Getting iPads to kids in public housing. Now they're talking that in public housing in New York City, they might not have Wi-Fi until the spring. What does that mean in terms of equity? What does that mean in terms of kids? If kids are trying to reach out, to whom do they reach out? And can they do that?
And I think that was a worry that we've heard from many units and school leaders, teachers, is that school is often a safe place for many students, and that is where students get help. They often have health services there and mental health services there, and they're getting meals and food. And during the school building shutdown, because we know school continued, but during the school building shutdown, and even now, things like instances of domestic violence went up, and instances of child abuse went up, and intervention was hard, because if a child is in your school building, then you have that connection with them. But if a child is remote and possibly in a dangerous situation in some aspect of their lives, it's hard to find that out. So, I appreciate that, Bob. And talking about tech equity, I know, Michelle, you guys are working on this as well, something that PTA is working on, the state education department, and I know Interim Commissioner Rosa and Vice Chancellor Brown talked about this on Friday, but the state education department is really looking at that tech equity, as is the governor's office and legislature and all of our education associations, to try to figure out how we can, if we're going to continue in some type of remote situation, especially, and in all times, how can we get all children broadband access and Wi-Fi access and access to technology? We had a number of school districts that were deploying buses to areas of our state with Wi-Fi on the top of the bus, and children and parents and teachers and families would connect. They'd get the bus route for the Wi-Fi bus, and they would connect that way. So, and that assumes that they have a device to go on, or maybe there's one device for 5 family members. So how do you really make that authentic connection with students? I think it's a big issue we're gonna have to overcome.
And buses were also delivering lunches.
They were amazing. Heroes to our schools that did so much, especially March, April, May, June, with that immediate transition, and now trying to really make it work for every child, to give them, the high quality education for all that we all deserve. Michelle, I want to talk to you a little bit about some technology that has kind of developed and evolved, so even in these past months, to try to help, I'll say, keep kids safe. Let's talk about that a little bit.
Yeah, absolutely. I think in general, we've had to evolve pretty quickly ourselves, right? We offered all of our products for free. That I think every tech provider in general, not just GoGuardian, but everyone is trying to grapple.
Yeah, we saw that. Everybody kind of said, for that shutdown, whatever we have, you have, which was really nice. So many of our partners and tech companies just to say to school districts, we know you may not be able to afford it right now, but have it anyways, which was fantastic.
Yeah, but of course that also means that with so many, we're talking about a 40% increase in the amount of, logging on and traffic and things like that. And so what that means is that, we've had to evolve really quickly. And we also are trying to foster more communication, right? So we made our chat, kind of available to students and made teachers the kind of the ability to connect with them, receive questions from students even when they're not connected, right? So that was really helpful. We also developed our video conferencing solution that's privacy focused, right? So that students can kind of see each other, but so teachers can still make sure that they're on task at the same time, you know, be able to monitor the student screen, but still be able to see face to face and chat and, you know, be able to connect with their students, which, you know, we see that, you know, students are checking on their teachers, teachers are checking on their students. There's a lot of that going on, which is really heartwarming. But it just communicates the need for connection more so than ever, right? We also had to evolve our solutions in a lot of ways, right? You know, if you have a lot of students who have devices for the first time, we had to make sure that parents and family members were aware that their student was using a device that could have been monitored by GoGuardian. So we implemented new privacy features so families were aware. We also realized that students were watching Netflix quite a bit more than, you know, originally. And so, or maybe they were watching Netflix with their families. I mean, I know I am, right? Bob, I see you raise your hand too. And so you see that students are watching Netflix movies, and the subtitles are generating alerts because some of those movies are talking about suicide and mental health concerns.
Oh, I wouldn't even think about that.
And so we had to kind of pivot a little bit, but that's been really valuable lesson for sure, and learning. And so we've made quite a few iterations of the tool for that purpose. But like I said, what's really interesting is that search behavior, that Google search bar. The Google search bar, of course, you know, something we say in, you know, at GoGuardian is that, you know, no one lies to Google, right? You know, you'll Google like a troubling medical condition, right? Like what's going on with my toe, you know? But you'll also Google, you know, relationship advice. You'll Google mental health concerns, and that's what we see in our tooling. And so, in terms of that, we've seen quite a bit within active planning. So that's that active planning tool. And so within
Michelle, I want to stop you there, and Bob, I want you to chime in too. You know,
yeah.
tell me for parents and families, you know, tell me what active planning means in this context. And Bob, you chime in, and Michelle chime in.
Mm-hmm.
It's that, you know, the standard kind of suicide prevention interview that you have when you hear that a kid has ideation, is you try to get to see whether there's an active plan. You try to find out whether there's something very specific that they're going to do. And years ago, they used to say not to do that because it would lead to an actual suicide because you're helping implant the ideation, but that's not true. The truth is that once you begin talking about it, it becomes a little less real to the kid. And it enables you as a practitioner to get the right services for the kid at the right time. Everyone is serious, whether it's, you know, I'm going to get a gun and shoot me, and it turns out there's no gun, you know, it doesn't matter. It doesn't matter. And so you have to have a plan to react to that. And in an online world, that plan is different than it was in February.
Yeah, absolutely. For us, active planning means Google searches or writing in documents about pills, misspelling of medications, things like that. Talking about getting a gun to hurt oneself, things like that. Those are the kinds of alerts that we qualify as active planning. So 77% of those active planning alerts are from the Google search bar. And those searches account for 83% of meaningful interventions in that phase. And so meaningful interventions is referring to kind of the toggles that they have within the product to like say that they contacted a guardian, that they had a conversation with a student, that they notified authorities, things like that, right?
Okay.
And what's interesting about that, and I just want to mention this really quickly, is that there was a 2010 study by an author named MJ McCarthy, which found that among only youth, there is a positive relationship between Google searches for suicide or self-harm and completed suicides. And so there's an actual correlation, whereas actually that same correlation does not exist for adults. So that means that,
so I can see why this conversation is so important in our space, in our education space.
Yes. Yeah. And so, in terms of, what that means is that students are using these Google searches to plan, to seek support, whereas maybe adults are doing research, right? And so for us, what we've learned is that equipping districts and hopefully families with the same kind of level of data of like, look, let's watch out for Google searches specifically. Let's watch out for the trends in the year. We know that April and May seem to be problematic, right? Which, we know that call centers have the same problem, right? How can we make sure that, we can't do the analysis via demographics, but schools can, right? Download their alerting behavior and cross-analyze it with their demographic data. Where are their most challenging communities? How do they support them, right? All of that kind of thing is what we hope that this kind of, analysis can help provide support on.
And I think that's really important because we know not all devices are school devices, right?
No.
Many are home devices with don't have kind of alerting or filtering. And Bob, I know I'm sure, I say, I know, I'm assuming school counselors, now that kids are coming back into schools, are seeing that kind of increased engagement and conversations that may be needed. I know my son, I've spoken about him a number of times, has an anxiety disorder, and we saw over shut down his, increased need for support and services as well. Bob, is that common? Have you seen that as kids come back officially into the building now?
Yeah, for sure. They've put off conversations because the person that they usually speak to wasn't there, wasn't available at the moment in time. Because kids, especially the younger kids, they don't plan conversations like this. They wander into the office. They make notes. They say something to a friend because they know their friend's going to get help for them. That's how in-person world works. It's kind of cool to hear Michelle talk about how online world works for kids. But in terms of responsiveness to the kids as they come back, we're back to the subject we were talking about last winter. There's got to be the personnel in the buildings and in the districts to be able to respond to this kind of stuff. And the school superintendents say we need more mental health professionals. And they have for years, and so that hasn't gone away. I think that you're seeing more buildings going to sort of what we used to call wraparound services, where you not only have the school personnel available, but there might be some agency people available. There might be medical folks available because that's the best way to deliver it. So you see more and more of that around the state,
like a real school, community school model of supporting a child, Bob.
Exactly. That's I see a move toward that because it's perfectly appropriate. Yeah.
And I think you're right. I know we and our sister associations and really everyone in the education space for the past many years, again, will renew that this year, facing physical constraints from, COVID-19 recession. We need more counselors and licensed social workers and school support staff in our school buildings. That's something that I think we all have to continue to talk to our policymakers about and our school district leaders about. Some of our ratios, we know, Bob, you and I talk about ratios all the time. The average appropriate ratio is about 1 in 400. Is that kind of, and even to me, that seems crazy that one counselor would serve, hundreds of children.
Well, the recommended national is 1 to 250.
Oh, see, maybe our average is 1 to 400, Bob. Maybe.
Yeah, it's about 1 to 400 now. And there's similar recommendations.
So basically double the average. So double the recommendation is where we are now in New York.
Yeah. And it's back to the equity question. There's districts that don't have, kids report they don't have access to a counselor at all. In certain buildings or certain schools, especially from the elementary level, middle school level.
And we still have some school districts without a school nurse in New York State. So, something else we have to fix. Michelle.
Just doubling down on what you both said, I think it's super critical. And if anything, the data we see, we are really hopeful that schools, get the resources they need, coming back. I can't stress it enough. I think if anything, we're hoping that our data can help. When you see that in a school of 1,000 students, there will be one active planning alert every week. So, when you see that, you're kind of like, okay, like we got to find some way to get more, counselors and buildings, and connect students to services. So definitely agree with you both.
As a parent, I'm sitting here tearing up thinking, that's so many kids.
That's a
lot of kids. Yeah.
That's a lot of kids. And I think, so that brings us to, I think our last few minutes, if you can believe it already, we have about 5 minutes left. What can we do? I say we as PTA, we as parents, we as educators and teachers, we've been, collectively working on this issue for so long. so important. You know, we proudly passed the first in the country mandated mental health curriculum and inclusion in our schools. That's you know, now on year 2 of implementation. You know, we have obviously long sought, you know, adequate ratios for school counselors and social workers and nurses and all of the support system, teacher professional development and principal and parent professional development on what we can do. But what's next? You know, what's something that PTA can do and regular parents can do right now to both support their own child and to support their own mental health? I think that's important because many parents and families, we've gone through the same trauma together. So, you know, while we're supporting our children, we also need not to forget ourselves. Bob, do you have any thoughts on that?
Yeah, I think that it comes back to and we would say this before the pandemic, get to know the services that are available in your school. If there are services as a parent or as a PTA or as a, you know, just a community member that you think need to be implemented in your school, then ask for them. You are voters in school board elections, and so you're the ones who they're going to listen to. So even in a virtual world, find out what services are available. I know that one of the things that's happened that's kind of cool amongst school counselors is we've been talking to each other more during the pandemic because of virtual meetings like this than we did before. And so if somebody's got a great idea in Elmira, somebody in Delmar can implement it but they wouldn't have heard about that before. And the same thing happens, and hopefully you'll have good turnout at your PTA conference. The same thing happens at these conferences where if you hear somebody's got a great idea, something's been implemented in this area in one district, see if you can get it done in your district. And that's been kind of a silver lining in terms of communication amongst school counselors.
Yeah, I totally agree, Bob. You know, we're feeling the same way when we shifted virtually. We're connecting more, I think, with parents and members now because it's easier to go to meetings or it's easier to have conversations. Everyone can just log in. Again, tech equity is always an issue. Michelle?
Yeah, I would agree with Bob. I think that you know, taking a look at your services and I would advocate PTA can play a huge role in making some of those connections with the district. One thing I wanted to mention, of course, as we head back to school is universal screening. You know, I would say GoGuardian is you know, Beacon can play a role, but it's only one tool in the tool belt. I would say signs of suicide is a huge asset. Maybe try that. I would also say, again, more counselors, use your data. If your school does not participate in the youth risk behavior survey, sign up. You can, and then you can get all that data for your school district.
I'm writing that down, Michelle, because that's something that we have to talk about more. So, yes. Bob, I know I see Bob writing that down too.
Yes, the Trevor Project is a huge advocate of that, and they're one of our friends. I would also say that as much as we can as adults, model good mental health behaviors, right? Take breaks, take walks, play, cook, you know, chat about things that are not COVID related, that are not, you know, troubling as much as we can. And I think that's something that GoGuardian and the National PTA are working on is, you know, these kind of, these idea of like modeling behaviors and how can we help other PTAs like do that more, right? And so definitely something that we're really conscious of.
And that's a huge role for like family engagement, obviously. That's PTA's bread and butter, something that we should be doing every day in advocacy. You know, we know PTAs focus sometimes on fundraising and we understand that. But, you know, really advocacy, family engagement, now is the time for PTA to focus, you know, very uniquely and always, but very uniquely right now on those topics. And I will say the Mental Health Association of New York State has a fantastic resource that everyone should check out. It's the School Mental Health Resource Training Center. So we work with them closely. Amy Malloy gave a workshop this morning, I think, or maybe tomorrow morning. I'd have to check on site type of you know, similar type of topics for you know, what New York State in particular is doing to support school-based mental health. So make sure you check out the Mahaney's website as well. There are fantastic mental health partners, and we're glad to have them a part of our conference. We are out of time. That went so quick. Bob, Michelle, thank you for this critically important conversation. I think out of all of the conversations we're going to have these 3 days, this is at tops of the list. You know, as a parent, as a mother, as an education thought leader, I think nothing more important than this work right now. What we're seeing, you know, as children go back, is our children were in crisis. This is traumatizing, and this will continue to be traumatizing for our children and families for months to come. They may have lost a loved one. They may have experienced COVID themselves. Their teacher may have been sick. They now facing, you know, possible quarantines in school buildings and school closures. And we have to be there as an education community to support all of those children. Can't thank you guys enough, as always, for your partnership. Bob, Michelle, I think that's a wrap. Thank you so much. And everybody, we hope you enjoy the rest of convention. We'll talk to everybody, or what rest of our conference we're calling it, and we'll talk to everybody soon.
All right. Thanks, everyone.
Thank you.